So good morning, everybody. I know it's very early for those of you who are not on the East Coast. So we're just going to go ahead and get started by introducing ourselves and the purpose behind the conference, some of the topics that we're going to discuss today, and it's workshop. So we do have some work that we're going to ask you to do. And then we'll come back and meet in the closing session, and people will get to report. You can also use the chat to report throughout the day as well on what you find. But we hope that this is just the start of digging a little bit deeper into a much needed conversation and national initiative around crisis response. So I am Carlene Ponder. I am the Director of Disability Rights and Housing Policy for the ARC of the United States. I'm in our national office in Washington, D.C. And I have some colleagues here with me today. I have Leanne Davis, who is, she leads our National Center for Criminal Justice and Disability. And she's done that, Leanne, I think for a long time, has it been over a decade now?
Well, I've been at the ARC for over 2 decades, working at that intersection of criminal justice and IDD, or intellectual developmental disabilities. But the National Center just celebrated a birthday recently of 8 years. So we have been doing this for quite a while, and very excited to be here and to have this discussion today.
Thank you. And then we have Juan Guerrero, who's our policy associate and right hand for all of these cool graphics that you'll see today.
Hey all, my name is Juan, as Carly mentioned, policy associate. Really excited to be here as a POC. Just really excited just at the material that lies ahead in the conference.
So the issue of crisis response, what we're talking about specifically is generally a mental health crisis that impacts a lot of people who we represent here at the ARC with intellectual and developmental disabilities. I think 30 to 40% of people with IDD generally have co-occurring mental impairments such as depression or schizophrenia or some other issue, which might from time to time put them in a crisis situation. Unfortunately, what ends up happening when people are having a mental health crisis, or perhaps they're just displaying some behaviors that are associated with their disability, but in a moment of agitation, is that we don't have a lot of resources in our country besides law enforcement and besides, calling 911 to help people get over that crisis situation into a calmer state and then into community services if that's needed. And my background is one of an activist in the community on policing issues. In fact, I got started because of a person who lived in my neighborhood who lived with depression and schizophrenia, but who also, was an adult living on their own, so fully capable of living on their own, who happened to have a fateful encounter with law enforcement one day that resulted in him being shot multiple times and killed. And part of what came up in that scenario was a decision by the officer not to engage crisis services. And I just thought what could have happened had that officer made a different decision and had our crisis services been in a state where they could have responded rapidly, because I think that that's part of the issue, especially if you're an officer out in the field and you're making a determination as to, how much time something is going to take. If we don't have crisis services that are efficient, that are available to get out into the community and to help resolve issues, then, we tend to over rely upon one resource that was never really equipped or, thought of as a go-to for mental health resources until, we just began to overutilize that resource for everything else. So that is my personal interest in transforming crisis response. But I've also noticed as I've done this work that when we talk about, issues around policing and issues around race, sometimes, mental health will come up, but we never really connect it to this wider issue of disability in general. Disability in the intersection of law enforcement and mental health. Sometimes disability gets erased from those conversations, those national conversations around policing and what we need to do in terms of transforming, our system. And so I thought it was very, very appropriate for people who are impacted by disabilities themselves, and particularly people of color, to come together and give some perspectives on one, their own lived experience, our own lived experience, and two, solutions, like what would we want to see happen, and how do we make things happen, and how do we get there? What coalitions need to be formed, what work needs to go on at the policy level, federal level, state and local levels, and that's part of what you're going to hear today. In our sessions, we've got some wonderful speakers. Some of our sessions are going to focus on a youth perspective. Some of our sessions are going to focus on family impact, and others on solutions. We're going to talk about some of the work that we've seen in other places, like the state of Illinois, that's promising, just promising, because we actually have to get in there and make sure that these things are implemented in a successful way. But we also have to make sure that we're doing the work to educate ourselves on the state of things in our own local communities. And so that is part of what you're going to do today. And I'm going to turn it over to Juan to tell you more about that now.
Hello, everybody. So as mentioned, I'm going to just be asking questions throughout the event. It is going to be rotating. So as the event does go on, right now, I have the question up in regards to like what number to call in the case of an emergency. I know some folks have already answered it with like Cahoots, 988, some of them mentioned a friend. So hopefully throughout the duration of this conference, we just continue to like be honest about these questions. Like these are genuine questions, and 988 is a new resource, which is why we want to have this conference to be able to educate and inform the community, so you could inform yourself and also spread it to your own family, your own community, sharing about what exactly 988 is. So it is going to be rotating throughout the day. I'll actively be posting in the chats as we rotate through the questions. In total, there are going to be 5 of them. So they're going to be gauging just how you feel, sentiments, and just overall just wanting to make sure that we really feel united as we answer these questions, and be as transparent as possible as we really try to get down to what 9A is, its implications, and its intersectionality with the other areas of policy that we'll be covering today. And I'm going to drop the link in the chat, but feel free to go on and answer the first question if you haven't already.
Okay, good. I know there was an issue with echoing. So if you do hear us echoing, let us know, and then we'll try and put some more distance between us so that you're not getting that feedback from the computers. And so we weren't gonna answer questions in this portion, but I do want to answer this because this is a good question. Somebody says, does 988 really have the capacity to fill the volume of calls? I called a couple of weeks ago, was on hold for 15 minutes, and then the call dropped. And I think that is such valuable information, because that tells you right there that no, currently 988 does not have the capacity to fill the volume of calls that we're anticipating will continue to grow as more and more people find out about the number. But the second part of that is, what we're going to be talking about more today in detail in these sessions is that, we have to, 988 is just a part of the solution. It's a potential part of the solution, but we also have to decouple crisis response from armed law enforcement. We have to do that. We have to be able to provide people safer options when they are needing additional support outside of a phone call, when they actually need ground support. And there are stark reasons for that. We've all seen them, I think. So we're just so what you're going to hear today, you will hear honest conversation about where we have been, where we currently are, and hopefully where we hope to go. But none of that is going to happen unless we're willing to dig in and do the work. So, but thank you all for being engaged. You're already engaged. That's great. Juan, you said you put the questions in the lobby chat already?
Yeah, exactly.
Are people able to see any of the questions yet in the lobby chat?
Right now, they're able to see what number would you call for a mental health crisis and or behavioral health crisis at home. So we're just getting different responses like 988, Cahoots. We have another question from Jocelyn in the Q&A in regards to like other organizations pushing back about it.
You have a call.
Oh, sorry. Oh. I rarely get calls. But of course, when I'm on a conference, a live stream, I get calls. That's funny.
Hello.
Oh, I'm sorry. I need to hang up if I didn't do that.
Well, don't hang up because they transferred me to you because I'm trying to get onto the live stream.
Oh, you're trying to get on. Oh, okay. Well, here we are. We have a live situation. Yes. If you are having trouble logging on, the way that we are telling people to get on is actually through our YouTube live stream.
Okay.
So do you have the YouTube, the ARC's YouTube?
No, I don't.
Link?
Do I just search for the ARC YouTube?
Yeah, the ARC of the US. If you
Okay.
go to YouTube and you search for the ARC of the US, we are there. We are live.
Okay. All right. Thank you.
Okay, well, I guess that was an appropriate phone call to take, and hopefully that will help other people as well. Okay, and now we just have a little bit of housekeeping. So we have interpreters. We will have interpreters throughout the day, and I think Juan had a particular slide on some of our accommodations for the day.
Yeah, I think it's just signifying that we do have interpreters throughout the day and that there are accommodations. We have someone captioning and we have the interpreters available. So if you have any questions or you run into technical difficulties along the way, we just really want to emphasize to reach out to us. Please let us know. More than happy to make any accommodations that are needed. So just definitely, I'll be in the lobby, I'll be in the different rooms. So just reach out if you do have any questions about the accommodations available. More than happy to see if there's any difficulty getting access to those services.
So what you can do if you want to watch the sessions is that you can actually go in and join a session as it's live streaming, or you'll be able to view the sessions here from the lobby. And again, as we just mentioned on a phone call, you'll be able to live stream from YouTube. When we come back later, we'd love to get your responses to some of this homework. And even if your response is, I made a phone call and I couldn't get a hold of anybody, or I made a phone call and I was told they don't have that information, or I made a phone call and I was told that information isn't public or something like that. That's valuable. It's valuable to us, but it's also valuable to you and to your organization and your community to sort of see some of what the initial challenges might be to transforming crisis response. And with that, do we have anything else that we need to say or that we should answer for anybody in the opening session? Okay, somebody says a number of us aren't seeing the questions. If you could repost them. So do you see the bit.ly? There we go. It's a bit.ly link. And if you click the bit.ly link, you should be able to get the questions there. It's not working. Somebody says the questions aren't where the bit.ly link isn't working for you.
Okay.
So I just clicked on the link, and the question that came up for me is, what number would you call for a mental health and or behavioral health crisis at home? Okay, great. Bree says she was able to see the question via the bit.ly link. Thank you. And I see somebody's already answering. Somebody says 988 for LA County. And Sarah says she voted using the bit.ly link, but then the question did not change. No, the questions won't change just yet. One, we want to give people a chance to answer the first question. We want to make sure people have enough time to answer the first question and sort of gather your answers and thoughts there. And then we will change the question probably in an hour. So as the first session is underway, when you go back, maybe at the conclusion of the first session, we'll remind people to go back and take a look at the bit.ly link again, because there will be a second question. And the second, we're going to make the questions a little bit harder because some of you might have done some of this work already. You might already know a few of the answers. So we'll ask you a little bit more complex questions as we move on. Somebody says Cahoots. They would call the Cahoots program, which grew out of the Whitebird Clinic. Excellent program. Excellent. And yes. So seeing different answers in. And then we got an 800 number. Somebody put in an 800 number as well. The other thing is that when the speakers finish their presentations, we're going to ask them to come back to the lobby so that they can continue chatting with you. There will be Q&A in each of the sessions, but if the speakers have a little bit more time, we'll ask them to come back, continue chatting with you here in the lobby for a little bit, and then that way you can get more information that way too. And I see Alexia saying that she's getting, when she clicks on the bit.ly, it says that Juan's presentation is underway. And as soon as the activity is active, you'll see it on the screen. Stay put. Not sure what's going on.
Yeah. It's just, I guess it's like a mixed bag at this point where some folks are able to access it and some aren't.
Yeah.
My apologies on that end, but it's just, yeah.
I've received that screen, and if you put in your name and continue, then you can access the questions.
Okay. So is there any other housekeeping that we need to take care of here before we go into our keynote? Our keynote will be starting in just a few minutes. You're going to hear from Yesenia Regalado, who will introduce herself, and she's going to give us a little bit of a different perspective from that of somebody who's actually spent some time in institutions, both voluntary and involuntary. And there's going to be a lot to learn there on not just, we're talking about crisis response, which is the immediate, when people have to make a decision, do I call 911? Do I call 988? What do I do? That's the immediate. But then after that, we need to think about what happens to people as well, what the options are and what real community support looks like. Yes, there are planned breaks during this webinar. So we're going to go into our keynote in about 5 minutes. And then after the keynote, though, we are going directly into our first panel, which is on families. And then after that, there will be a 30-minute break, which we will use for, our lunch break. And then the rest of the sessions will have a 10-minute break in between. Okay, so we are going to end this opening introduction, and we will see you all in just a few minutes in our keynote session. Thanks for attending this morning.